you get night sweats? This is actually an extraordinarily important question with regard to your current and particularly your future health. Unless you're menopausal, night sweats means that you are doing extra work at repair and recovery at nighttime. You might be running a slightly elevated low-grade fever at nighttime that's leading to these sweats. What causes that? Well, classically, it's been related to tuberculosis, but there are many other organisms that can lead to inflammation and excess repair and recovery that manifest as night sweats. The reason why this test is very important, or the answer to this question is very important, is because sometimes with a low-grade infection, a chronic infection, and the inflammation associated with that, your blood counts aren't particularly elevated, so it may pass scrutiny, whereas the symptom of the sweats will help healthcare professionals maybe ask more questions and dig more deeply and solve a very important chronic disease question for you. So let's dig into the things that can cause night sweats. So first of all, the new germ theory, this is by Professor Paul Ewald at the University of Louisville in Kentucky, an evolutionary biologist who says that some of the most baffling non-infectious illnesses will turn out to be pathogenic when we look at it. In other words, low-grade chronic infection. Sweats have been reported in patients with babesia, a type of Lyme. And we see quite a lot of people, 46%, that have night sweats that have babesia or Lyme disease. Of course, tuberculosis is associated with night sweats. And there's other bacteria that can lead to night sweats, Mycoplasma pneumoniae, and importantly, chlamydia pneumoniae. This infection comes into the respiratory pathway, but then gets into the blood vessels and really starts causing inflammation and deterioration of the lining of the vessels, leading to heart attack, stroke, and because the brain is so vascular, even Alzheimer's disease. So night sweats should not be ignored, and it's a sign of something maybe infectious, maybe not, but at least the healthcare professional should look into it for you. And if it's found, then at least we know the cause, and there are very often solutions to this. So night sweats, a very important question and answer. Thanks very much.